Okay, we're going to go ahead and get started just to be mindful of everybody's time, and we're going to go ahead and get started. Okay. Good afternoon. My name is Victoria Lancy, and I'm the Rural Education Manager with Michigan Center for Rural Health, and will be facilitating today's program. I would like to welcome everybody to today's Oral Health Grand Round on bridging the gap, bridging the dental and medical care gap to improve children's oral health. Michigan Caries Prevention Program is brought to you by Michigan Department of Health and Human Services Oral Health Program and Michigan Center for Rural Health. Before we begin the program, just a couple reminders. If you're logged into the webinar portion and have computer speakers, you can listen to the audio through them. If you're listening to the webinar portion through the audio number provided, handouts are located on our website, and I also emailed them out to everybody. As mentioned, handouts are located on our website at www.mcrh.msu.edu. Click on the education link across the top, find the calendar, and then find today's date, find the more details, and then there you will see the attendance form, presentation, and evaluation link. Also, on the education page, there you will also find a calendar that says February, and then if you click on the February calendar, all of the information will also be provided on that calendar. The attendance forms need to be mailed, faxed, or emailed into the Michigan Center for Rural Health office within 2 weeks, and the evaluation must be completed online. It needs to be into our office by March 1st. If you would like to ask a question during the program, please type it into the chat box so you don't forget it, and the presenter can address it during the Q&A component at the end of the program. Our speakers today indicate no conflict of interest, and the planning committee did not have any conflict. There is no commercial support for this program. At this time, I will turn it over to Susan Deming from Michigan Department of Human Services, who will introduce our speakers today. Go ahead, Susan.
Hi, good afternoon. I'm Susan Deming. I'm with the Michigan Department of Health and Human Services in the Oral Health Unit, and I'm the Early Childhood Oral Health Coordinator, and we'd like to thank you for joining this afternoon's webcast. And here at the department, we're proud again to collaborate with the Michigan Center for Rural Health to offer these oral health grand rounds, and we do several a year, so you can watch for those or contact me if you want to know which next one is coming up. We also work closely with the Altarum Institute, which is a nonprofit health systems research and consulting organization, and their staff will be talking to us today. They received a large grant award a couple years ago to focus on improving oral health for children in Michigan. Aman and Amanda are here to share some of the projects they've been working on, how their efforts have greatly improved the oral health of our youngest Michiganders, and offer resources that you can use to help your own communities improve oral health. Iman Alam is a public health analyst in the Altarum Institute's Health Innovations and Technical Assistance Group. She's the implementation lead for the Michigan Caries Prevention Program and the product owner for the Michigan Dental Registry. The Michigan Dental Registry is a web-based IT solution that significantly advances oral health coordination between the medical, dental, and public health stakeholders in Michigan, which you will learn more about today. She also coordinates project reporting to CMS and facilitates communication with program evaluators. Ms. Alam received her Master of Health Service Administration degree and a Bachelor of Arts degree in Sociology from the University of Michigan. Amanda DeLancher is a public health systems analyst in Altarum's Health Innovations and Technical Assistance Group. She serves as program coordination lead of the Michigan Caries Prevention Program, which you'll also hear more about today. She is responsible for managing a statewide stakeholder strategy, which helps determine alternative strategies for program implementation. She facilitates program execution in the state, including a successful WIC oral health integration pilot. And she holds a Master's of Science degree in Health Education and her Bachelor's of Science in Kinesiology from the University of Michigan. So go ahead, ladies, you're on.
Thanks, Susan and Victoria, for the intro. My name is Amanda DeLancher, and I have on the line with me my colleague Iman Alem, who I'll hand it off to periodically. She and I are going to be tag teaming this presentation. Thanks again, everyone, for your time today and for the opportunity to share with you more about our program and what we've built for Michigan's care providers. Next slide. So today's presentation, we're going to go through an overview of Altarum, give you a little more background on our organization, and then share more with you about the Michigan Caries Prevention Program and the various components there. And then we will actually give a demo of the Michigan Dental Registry tool. So Altarum Institute, where Iman and I work, is a nonprofit healthcare consulting organization, like Susan mentioned. We are headquartered in Ann Arbor. We have offices in the DC area, Maine, and Virginia. And we've been a Michigan company since 1946. We have deep connections to the University of Michigan College of Engineering, Medical School, and School of Public Health. So these project areas listed here in this infographic are just some of the areas where we have work either through federal government contracts or consulting work for various organizations focused on health and healthcare. So the Michigan Caries Prevention Program was born out of an award, a Healthcare Innovation Award from the Center for Medicare and Medicaid Innovation. We began our project period in September 2014. We were awarded $9.4 million to do something to reduce the burden of childhood oral health disease in Michigan. Our project proposed the high-level aims that aligned with the triple aim, with the overarching goal of creating a systems-level solution to improving children's oral health. Our partners in this effort are really critical to our progress and success thus far. Our partners are Delta Dental of Michigan, the University of Michigan School of Dentistry, and the Michigan Department of Health and Human Services, and Susan herself is on our project as well. So oral health was actually a new realm for Altarum as a healthcare organization. But once we dove into this, health disparities that were surrounding this issue and the disease burden that's impacting children, we really became very passionate about this topic as a chronic disease that we can make an impact on. So tooth decay is the most common chronic infectious disease in the U.S. and afflicting children. More common than asthma, and yet it's largely preventable. In 2013, over 60% of Medicaid-eligible children did not receive any dental care. So even though Michigan is unique in its Healthy Kids Dental reimbursement model, there's still an access barrier happening that's outside of dental reimbursement. So we looked a little deeper into what the age was at a child's first dental visit. And we found that young children often see their physicians 8 to 11 times before they ever see a dentist. And when they do finally establish appropriate dental care, they have rates of decay that require anesthesia or levels of in-office sedation that not every dentist has the capacity to handle. So dentistry as a field is founded on prevention. One of the original healthcare branches that really has been all about prevention since the very beginning. So our approach, we knew we needed to identify the children that were in need of care and promote evidence-based care among providers in the state, and then link those children to the appropriate care providers, and then develop a way that we can manage and monitor this care. So our three main project components that we launched in the last few years have been our robust technical assistance and training to primary care providers to prepare them to meet the oral health needs of their patients. Iman will provide some more detail on the technical assistance program itself, but this primary care integration of oral health is really key to capturing the child before the decay, before dental disease has onset, and to arrest the progression of disease if it's already started. So getting the, identifying the children in need of dental care and referring them to appropriate care at an earlier age than they would have otherwise established care. We've also launched a few community engagement strategies, including the development of Smile Connect, which is an online portal that connects dental services and resources to children as a web level for community engagement. And then we've also built the Michigan Dental Registry, the IT solution that is facilitating communication and patient referrals between medical and dental providers in the state, which Iman will provide the demo of today. And with that, I will turn it over to Iman to talk more about the technical assistance.
Thanks, Amanda. Okay, so the technical assistance program, the goal of it was to make a significant change in the primary care provider's perspective on better understanding the role of oral health and overall health, and assisting them, providing the resources needed to help them better integrate the preventive oral health services that they can integrate into their clinics, which is applying that fluoride varnish every 3 to 6 months, conducting an oral screening, and placing a referral to the dentist. So we deployed our technical assistance program last summer in July, so 2015. And as of today, we've trained over 1,400 providers across the state. These are family practice physicians, pediatricians, and residency programs. The technical assistance itself involves an on-site 1-hour training where we train the entire clinic, this is including the clinical support staff, in the Smiles for Life curriculum. We provide them with Smiles for Life certification. And as part of the program, we offer 30 CME credits and 20 to 25 MOC Part 4 credits. We partnered with the University of Michigan Medical School to classify our program so that we could provide these credits. The training involves that one on-site training, and then there's follow-up for up to 7 months in which we're collecting data, first on the baseline, better understanding where these primary care providers are before our training in regards to applying fluoride varnish, doing that oral screening, placing that referral, and then 3 months later, getting data pulled and understanding how they've implemented into their clinics. Through that data, we understand sort of where they are with implementation, and we sometimes deploy additional resources and training to get them to better integrate these services. And then we check again 3 months later, and we see where they're at. And then based on that performance, we're able to award them those CME credits in MOC Part 4. This is a huge incentive for primary care providers who need to get 50 CME credits every year, and then the MOC Part 4 they need to achieve every 5 years. So this bundles that up, and through our training, we provide enough resources that it's easy to get. As I said, we've trained over 1,400 primary care providers. 300 of them were residents. So this was our way of getting it in where residents are getting it in their training, they're implementing in their clinics where they're practicing, and then they're more likely to continue that practice on wherever they go, whether it's in Michigan or outside the state. Along with that, we've trained over 1,400 clinical support staff, and through that impacted over 400,000 Medicaid children. We look specifically at Medicaid children as part of our program goals, but we know that the providers are applying these new services to not only their Medicaid children, but also the commercially insured children. So the impact is actually greater than that. As you can see here, this chart looks at the data for those clinics that have completed their 7-month cycle. Oral health screenings were at about 14% on average, fluoride varnish were at 5%, and then those dental home referrals are at 6.7%. Through our training and follow-up, we were able to get those to 94%, 52%, and 89% respectively. So we've been able to see a significant impact from our training, and we, because the training is 7 months long, we expect that this behavior will continue on beyond the actual engagement. from that, I'd like to hand it back to Amanda on the community engagement.
Thanks. So we knew from the beginning that not every area of Michigan would have the dental capacity to meet the need. So we tried to think through some alternative care strategies. That's what we called them. Just ways, outside of normal care channels to bring oral health education and preventive services to children who might not be able, who might not be able to make it into the dentist. So we did a couple things. The first one was a WIC pilot. We actually trained staff in 5 Detroit WIC clinics that were some of the most highly used WIC clinics. So they see a lot of participants in those 5 clinics. In fact, they see 23,000 children and infants in just those 5 clinics on an average monthly basis. So those staff received training to incorporate the Macmillan Health brush education into their nutrition counseling. So what we found from that pilot is actually, because we've done a couple focus groups and some surveys with the staff to see how it's been going as a process evaluation. And the WIC staff have been really positively receptive of the nutrition education topic. In fact, they've shared that oral health, discussing oral health provides an impartial way to discuss sugar consumption with families as opposed to discussing obesity, which might be a hot button issue. So this effort with the Michigan WIC was actually a supplementary effort funded by Delta Dental Foundation, and it was conducted in partnership with Macmillan Health and the Michigan WIC program and Altarum. These staff have been doing this training since January 2016, and so they've incorporated a new nutrition education topic into their normal counseling that they do with families. And we've also uploaded a dentist referral list into the Michigan WIC MIS system, which is called MyWIC. So the WIC commonly makes referrals for their families to various healthcare and social service providers. So we've just, working with Delta Dental, we're able to provide them with a zip code based dentist referral list of dentists that accept the Healthy Kids Dental reimbursement. And they're able to make that referral. With the MyWIC system, we're actually capturing robust data on the actual encounter. So not only how many kids are receiving this education, but how many are receiving a referral, which will be cross-referencing with our dental claims data that we'll get as part of the Michigan Caries Prevention Program to actually assess the efficacy of how often the referrals made in the WIC setting resulted in a dental visit. And additionally, we have launched an innovative tool called Smile Connect. It is an online portal that was built out of the need that it came from conversations that we had with our dental school partners, both the University of Michigan School of Dentistry and the University of Detroit Mercy School of Dentistry, in terms of what their students were required of for their community-based education. And then in discussing, and hearing from community groups that a lot of them just didn't know, and organizations that serve children didn't know what resources were available. So Smile Connect serves to bridge that, make this connection between those who have the resources with those in need. So how Smile Connect works is that there is schools, teachers, community organizations that serve children can post requests for oral health supplies or to receive education or to receive preventive services, and they put their request on Smile Connect. So they could request things like having a dental student come to their Head Start and on a monthly basis and give a talk about oral health to the kids, or it can be having a dentist come to a health fair day to do services, to provide dental, preventive dental services at that health fair day. Or as simple as requesting toothbrushes to be able to be distributed in a WIC clinic. So these type of requests are posted on Smile Connect, and then dental providers and dental hygiene students, along with dental supply companies and philanthropic funders, can browse the smileconnect.org site and find requests that they're interested in connecting with. And then they can fulfill those requests. So you go to the next slide. So this is our impact to date. In the WIC pilot, as I mentioned, since January of last year, 5 clinics have been trained, and we're actually looking to expand this with Delta Dental Foundation funding to an additional 16 clinics across Wayne, Oakland, and Kent counties this coming year. And Smile Connect was launched in February of 2016, and we are piloting it in Michigan. It's been piloted in Michigan with the intent to go to a rapid national expansion. So already since February, we've expanded to an additional 27 dental and dental hygiene school partners in 13 states. In terms of philanthropic sponsors and organizations who have been fulfilling requests for various dental supplies or funding the purchase of dental supplies, has been, that includes Delta Dental Foundation, Benko Family Foundation, Sunstar Americas, America's Tooth Fairy, and the Ohio Dental Association Foundation. To date, requests made on the site has resulted in over 5,900 children in schools, community events, WIC clinics, tribal clinics, and more receiving actual preventive care and or oral health education. Okay, and with that, I will turn it back over to Iman to share more about Michigan's Dental Registry.
Okay, so Michigan's Dental Registry, or what we sometimes call MIDR, was built as in an effort to integrate medical and dental communication. It was built to facilitate that communication, allow physicians or even dentists to place referrals to dentists who are accepting Medicaid-eligible children or Healthy Kids Dental in order to result in more successful referrals. So it's a clinical tool. This web-based platform allows primary care providers and dentists to track preventive oral health services and then place that referral to the dentist. We partnered with Delta Dental of Michigan to offer this dentist search. The search allows providers to search for a dentist based on name or distance, and to also specify what kind of specialty they're looking for. And then based on that, they're able to see a list of dentists and see additional information such as hours of operations worked, language spoken, so they can then use that additional information to select the best dentist for their patient. We were also classified as a meaningful use specialized registry early 2016. This means that eligible providers who attest to use the system can use this to meet their meaningful use requirements. As part of that engagement, they agreed to submit certain data. We look at fluoride varnish rates, oral screening rates, dental referrals. On the dentist side, we ask for additional information such as dental sealant, and they submit that data on a periodic basis and use that to then achieve federal incentive dollars from the government through their meaningful use program. We then will use that data through the registry as well as data that's being put into MIDR to look at population health monitoring at an aggregate level. How is access? Are patients getting to a dentist when they need to? Are fluoride varnish rates higher than claims make them seem to be? Oral screenings, things like that. We're able to better report at a state level on our EPSDT rates, fluoride varnish, oral screenings, things like that. As a clinical tool, MIDR is available on the MyLogin State Single Sign-On, which I will show today, as well as Oscar's Professional EHR. We're working with several other EHRs across the state to integrate our system, therefore make it easier to use by most primary care providers. Our main users are primary care providers, so physicians, family practice, pediatric physicians, as well as dentists. And the system is pretty straightforward. We're looking just to track what care was provided, track any notes to the other provider, such as if the dentist wants the physician to help the patient kind of come back within 6 months to finish their treatment plan, things like that, just to help that counseling, change behaviors, and then to facilitate that dental referral. I'm going to step away from the slide deck and show you guys how exactly you can access this. So we are available via the My Login for third party. You would log in if you have a login already, and if you don't, you can create a new account. It's pretty automatic. And then if you do have an account, you'll go ahead and log in. I'm going to show you what a medical provider sees, and then we'll go through the dental provider. If you don't have MIDR already as one of your applications, we request access through here. And we are an application listed under the MDHHS system, or you can go ahead and just search directly for that application. Now, when I search, it's not going to show up because I already have it on my homepage. But if you don't, you would click on that, click request access, and go through the process. Sometimes it takes a few refreshes for it to show up here. Once it does, you select it, and there's a quick create a profile that you would go through. This user already has a profile, so as you can see. Medical view, you can search by using a Medicaid ID, and we'll go ahead and do that. And what I'm going to search, I'm searching for a patient that's already in the system. As you can see, the patient, once I press enter, it pulled up the patient. I get the information that's available through the system. I can add this patient to my patients. So if I click that, it will add it to this list. That way it's sort of easier for me to look them up later. You go through here. This is actually, I'm showing you guys through a test system. This is a new feature we're providing within the next week, in which you're able to, if you want to prepare for the next day's visits, for example, you can look up each patient and print a patient summary that will let you can print this out and sort of attach it to the patient chart. And that way you know exactly what kind of care is needed the next day. So this patient, for example, already is up to date on fluoride varnish, so we don't need to apply varnish. And they have a referral. Let's follow up and see if they finished, if they called and made that appointment. In many cases, because the system is starting to get used at this point, we don't have an existing database. So what you can do is, if you put in a Medicaid ID that is not in the system, you'll add that patient. So if I hit add patient, we just need this basic information: first and last name, phone number, date of birth, and sex. And if you want to add that patient to your list of patients, you do that and you'll press save. So we'll go back, we'll select the same patient I looked at before, and then we'll go through the system. It's a one-page application. You're looking at treatment update and referral. As I mentioned, we're looking at these two specific kinds of preventive oral health services. As I can see here, this patient's up to date on their fluoride varnish, so I'm going to say that they're not indicated for fluoride varnish. But I did do an oral screening, and I saw obvious decay. And one thing I'm concerned that I want to make sure the dentist knows is that they're putting juice in the bottle at night. So then let me just go to my clinic. This is in case you're a provider and you practice at multiple clinics. You can go ahead and add as many clinics as you like. When you're saving for that patient, we like you to select which clinic you're saving for. And there you go. My selection has been documented, and my selection will be stored under treatment information. As you can see here, fluoride varnish, oral screening, not indicated, obvious decay, and my note. Here I can see all the care that's been provided to that patient. So if they've been to the dentist before, this is one of the dentist users, I can see, the dentist actually placed a referral to another dentist. That dentist also provided dental treatment, restorative care. So I can see all of that here. Next is that referral. Say, for example, this patient does not have a referral, doesn't have a dental home. I want to set them up for preventive care, and I'm looking for a dentist in the area, 4105. This patient's very young, so I really want them to see a pediatric dentist, so I'll do that. Press search, and as you can see, pull up a bunch of dentists. I see additional information here: their phone number, fax number if that's available in the system, specialty, any languages they speak, their availability, and if they're accepting new patients. I have a fax number. This this system, as we mentioned earlier, is pinging directly the Delta Dental Healthy Kids Dental database. So it's constantly up to date with the latest information on which dentists are active, what their address is, what their phone number and fax number is. So you're able to use that, make sure that you're placing a referral to a dentist who is accepting new patients. So once we decide, okay, I want to send them to Larry Feldman, I'll send a referral. And I can either print the PDF and process that referral on my own. Through our conversations with medical providers, we found that that is a feature that they like to have, or they can send a fax. If you send fax, MIDR will actually send that fax for you directly to the dental office. We don't send any PHI, so I'm going to show you what we send as a referral. As you can see, the treatment was saved. I'm going to look up the referral that was sent, the letter. We have a cover page with the dentist we sent the referral to, the user who placed that referral, and then a short letter just letting them know that I referred a pediatric patient for evaluation and treatment. Here's the referral ID that dentist will then use to look up the patient, and then any information they might need to reach out to us. They have a phone number and an email, and a little bit of information about the system. Because the system is new, we're using these referrals also to educate these dentists about the system. And then what we do on our end, in order to increase the likelihood of successful referrals, we follow up with dentists who receive referrals who are not MIDR users in order to get them into the system. So I'm going to use this referral ID here as a dental user in a moment. We're going to look up the dentist that for the patient who we just placed a referral for. Okay, I'm going to log off. Oh, this is a referral summary you can print and give to a patient. It tells them who they were referred to, why they were referred to that person, and then what the latest treatment they received was. I'm going to log off. I'm going to log out, and I'm going to log in as a dental user. Again, dentists access the system the exact same way. They can request access to the same system, and then when they make an account, they select a few different options, and that helps us classify them as a dental user versus a medical user. Dentists can search using a Medicaid ID or a referral ID. Because we received that referral, I'm going to place that in here and search. So that's the patient who we just saw. We'll scroll down. And I can see the latest treatment that was provided. So the first thing they see is exactly what happened for that patient, why they were referred. And as you can see, we can see the note from the medical provider who said that this is their concern, juice in the bottle at night. So you're able to use that and then go back to that patient and say, hey, this is what we're concerned about. Let's focus on changing this one behavior. And then slowly you can help sort of prevent decay from happening in the future. Dentists use something very similar to the physician. The difference is they also have a dental treatment section, which we require for them to fill out if they're going to do a treatment update. And that's, we ask very high level, was preventive care provided versus restorative or just diagnostic. You can select multiple options. You can just select one. Any notes. If, for example, you are filling this out after a patient visit, you're updating a bunch of records at the end of the week, that can be done. You just go ahead and select a different date. Let's say February 8th, when this care was provided. And we also saw obvious decay and that restoration fillings were present. And I didn't apply fluoride varnish because varnish was already applied. And then here I might say, initiate a treatment plan. And please encourage patient to return within 6 months. It might be shorter than that typically, but we'll just do that. And we'll press save. Oh, I didn't select a clinic. We'll do that here. Dental clinic. Okay. So that care is saved right here. Initiate treatment plan. Because we put it for a date before the medical doctor, that's why you're seeing it a little earlier. Fluoride varnish, again, not indicated in oral screening. As a dentist, I can also place a referral to any dentist. And what's helpful about this is, again, I'm placing a referral to a specialist who is accepting Healthy Kids Dental. So if I need them to go to an oral surgeon, I can do that here. I can search by name. If I know a specific dentist who's in my area, what we see often, what users will do is they have a few dentists that they have relationships with, or for FQHCs in which they have co-located medical and dental providers, they'll place referrals directly to that dental clinic if that's what the patient wants. And then they also are able to communicate directly with that clinic that's co-located with them, and they're able to kind of strengthen that relationship. So we've seen that happen. So there are no alternatives. To accept it. We can do a partial name search. There we go. We'll say, oh yeah, I know Stuart Ronald. Let me go ahead and select that and place that referral. Again, same exact process. Oh, emergency job kit. The same exact process, send fax or per PDF, and then that referral is saved. So that is the complete flow of the Michigan Dental Registry system. We have a few different features, such as you're able to contact us if you have any questions. We have users reach out oftentimes if they accidentally put in the wrong data about a patient, and so we reach out to them directly after that, and we'll call them and get the information we need, and we'll update that information in our system. The frequently asked questions are available here as well, and then this is just our grant disclaimer. Adding a new clinic is easy. You just click on add a new clinic, and then we can say none of these clinics are mine. I'm going to add a new clinic here, and you'll add the information and submit. Okay, and then let me go back. That's the end of our demo. I'd like to open it up for any questions, I think. Okay, so I see that there's a question in the system. If you can print off a PDF after you submit the fax referral. Yes, you can. You can always go back and look through the treatment information and print any PDFs from the past. And you pull it up, and then you go ahead and download or print directly. And then you can also do the actual referral that was sent if you for some reason want to track that or put it in your chart. That's also available. Those will always be available as long as they're in the treatment information section. Are there any other questions, or I don't know if you guys want to unmute yourselves and ask, or you can send the question through the chat feature? Okay, so nurses and hygienists can also sign up for the system. Let me show you how I actually can walk through. When you try to create an account, this is the first page that you'll see. So let's get started. And then whether you're in the medical or dental flow, you'll select that. So for medical, we'll click that. And then here you'll select your role. If you're a physician assistant, or nurse practitioner, you'll require an NPI. And if you're not, then you'll select one of these. So let's say a physician, there's an NPI field. If there isn't, then, and then select the clinic. We've preloaded as many clinics as we could, especially the ones that we've trained or we've had communications with. That way it makes it easier for you to then add your clinic. But if your clinic is not listed here, you just go to the end of the drop-down and you add a new clinic. If you are a medical user, what we do is if you already have access to MIDR, we will automate the approval process because we kind of use that to understand whether you already have access to patient data. If you do not have MIDR access, you'll enter a pending approval process and we'll reach out to you. We just need to gather a little bit of additional information before we'll approve you to get access to the system because it is Medicaid data, it is PHI, and we just want to confirm that you're a care provider. If you are a dentist, you'll go through the dental flow. If you have received a referral, this is an option because if you have received a referral, you can press yes and place that referral number here, and then we'll pre-fill the information for you. So if you had that referral, we'll say, oh, okay, hey, are you Dr. Larry? And if yes, here, this is your user information. If you do not have a referral, most people don't, you'll just press no and go through this process. These are the roles we currently have: dentist, dental hygienist, dental assistant, and administrator. Similar to the medical flow, if you're a physician, if you're a dentist, we require an NPI number. If you're not, you won't fill in the NPI number. For, again, because we can't use MIDR for dentists, if you are a dental hygienist, a dental assistant, or an administrator, you do go through the manual approval process as well. We reach out to you and your clinic, and we just, what it is we need a contact person at your clinic who we can communicate with regularly, just to make sure that in case you leave for another job or anything like that, they'll let us know to change your access. And so we just need somebody at the clinic who we can communicate with and make sure we have our access rules up to date. And next question was, can PA 161 programs use this? Yes. We actually, we were in conversations with some PA 161 programs in the area, and they can sign up to use this. We can actually add a role here for PA 161 if they don't sort of fit under any of these roles. And then we would just communicate with their supervising dentist. That would be that contact person who we would check with every 3 to 6 months to make sure that PA 161 is still operating under their supervision. Are there any other questions? In Cleveland. Now, I know we will be sharing the slides with you after this, but you can also always visit michigansdentalregistry.org, and from there, you can either directly access the system, and I'll go ahead and click that, and that's where we check to make sure you'll log into your My Login, or you can learn more information about MIDR by visiting our myteeth.org/MIDR.html site, and here you'll find more information, how to request access to My Login. We have a walkthrough PDF, as well as how to create certain profiles. So that's information there that I just walked through. Frequently asked questions. There's a video demo. And then this is the meaningful use piece. As I mentioned, we are a meaningful use specialized registry. And so in order to, what we've been able to do is sort of expand our user base so that it's not only physicians who can use, currently most of the specialized registries are really specific to medical providers. This one expands it to dental providers, those dental providers who are trying to meet meaningful use, but there aren't enough opportunities to check off those boxes. You're able to attest to use the system, and here you'll find more. If you click on that link, you'll go to the Michigan Health IT website. And then what we do is we make sure you're tracked on the Michigan government's website, which is called HISTR. We'll sign you up there, say that you've attested to use this public health registry, and then when you're ready, you'll start putting together certain reports. You can do that through your practice management software or your electronic health record system, and we ask for certain data depending on the kind so you get to kind of choose what data you report on based on how you practice, and then you submit that regularly. And just through that, you're able to check off that box of using a specialized registry. Here are the contact information if you'd like to reach out to us with any additional questions or the meaningful use component of the clinical tool is completely optional, and you could use the tool on its own, or you can use. And you can also use the tool. We see in some clinics who decide tracking preventive oral health services isn't as beneficial for us because we do it in our EMR and we have a way to track who gets, try to reduce duplication of care, and they just want to use the referral. That's allowed. You don't have to. Those two components of the application are completely up to you to use how it works in your clinic.
So I see another question came in about marketing to dental professionals, and I'll take this question. So what we've been doing, we are trying to do a lot of active outreach. We have some communications that are going to be coming out, hopefully soon, through the MDA Journal, through the local dental societies, and through Delta Dental in a couple of their provider newsletter on the Delta Dental billing system, and other communication channels that Delta Dental has. We've given presentations to local dental societies and are actively seeking further opportunities. So if you are interested in having Iman or I speak about MIDR and this Michigan Caries Prevention Program to your dental society, please let us know. We also have slides available that we can share. If someone in your community is already using MIDR or has already been trained and would like to champion it and give the presentation at one of their local professional membership meetings. So please just let us know. Our contact information, I believe, is on the last slide.
We also do on-site visits to onboard your team if you need to. We'll do presentations as well as kind of walk you through the process and get everybody signed up.
Yes, so if you have a front desk staff that you'd like to connect with us to get your clinic registered on MIDR, please email MIDR@altarum.org and we can have someone reach out to them by phone or email to help walk them through that process. Any other questions?
Okay, I think we'll hand it back to you, Victoria.
Okay.
Thank you so much for everyone listening.
Yeah. Thank you, everybody, for coming and joining us. I will, if you have a question that you can think of later, please feel free to email the presenters, or you can email me directly, or you can indicate it on your evaluation, and I will pass it along to our presenters. Thank you for joining us, and everybody have a great weekend and the rest of the afternoon. Thank you.